Well, the ability to follow a lesion really depends on the type of lesion that you're following. There are some lesions that are clearly benign and don't warrant follow-up, and those can be things like adrenal hematomas, adrenal myelolipomas, adrenal cysts, and then there are other lesions which warrant immediate surgical or medical treatment, malignancies, metastatic disease. There is a certain gray area for lesions that are considered indeterminate or considered benign based on imaging. Usually, there are some guidelines that can be used. So for a lesion that is expected to be benign based on imaging, we usually recommend a follow-up in approximately a year's time with biochemical or hormonal evaluation for, I think, 4 years. A lot of the earlier research on adrenal lesions was based on CT imaging, and one of the strengths of CT imaging is that we have very defined criteria to determine what is a benign lesion. Now, unfortunately, not all benign lesions will follow those criteria, and that's kind of the gray area. But for those lesions, particularly those that are small and homogeneous and measure less than 10 Hounsfield units, those are considered benign and should probably be treated as such.